Whoops. Hang on. I always do this stupid thing like that. So let's go to, where are we? Okay, we can see this, correct?
Yes.
Yes.
Yes, sir.
Okay, we talked about the pituitary gland and the hypothalamus. We talked about their association between the two. We also talked about the two hormones that are secreted by the posterior pituitary. They're actually made in the hypothalamus and stored in the posterior pituitary. And we talked about the 7 hormones that are released by the anterior pituitary. Okay? Now, let's talk about the thyroid gland. The thyroid gland is a butterfly-shaped gland located in your anterior neck, right below the larynx and anterior to the trachea. It is divided into an isthmus, which is the middle, and 2 lobes, a right lobe and a left lobe. It is made of 2 different types of cells. The follicular cells are stimulated by the pituitary. The pituitary produces thyroid stimulating hormone. It stimulates the follicular cells of the thyroid gland to produce thyroxine and triiodothyronine, otherwise known as T4 and T3. These are your thyroid hormones, and they're produced by the follicular cells. That is the main hormone that comes from the follicular cells of the thyroid gland, T3 and T4. The thyroid gland also has other cells in it, and those other cells are called parafollicular cells, and they also produce a hormone. And the hormone that they produce is calcitonin, and calcitonin helps regulate calcium metabolism. They are 2 separate hormones from 2 separate cells. The follicular cells are under the control of the pituitary gland. The pituitary gland produces thyroid stimulating hormone, which makes the follicular cells of the thyroid gland produce 2 hormones, T3 and T4. Those are your thyroid hormones. The parafollicular cells of the thyroid gland are under the control of calcium in your body. And that is extremely important to understand. When your calcium levels are too high, the thyroid gland from the parafollicular cells produce the hormone calcitonin to lower your calcium levels. We will talk about another gland that raises your calcium levels. Calcitonin from the thyroid gland lowers your calcium levels. Here is the parafollicular cell, which produces calcitonin, and here is the follicular cell that produces T3 and T4. The thyroid hormone that is produced, which is T3 and T4, whenever you say the word thyroid hormone, you're talking about both T3 and T4, okay? The thyroid follicular cells have a colloid in it, which is a protein called thyroglobulin. Thyroglobulin, in the presence of iodine, makes T3 and T4. They go into it in great detail. You don't have to know the 8-step process. That's not important. What's important is that T3 and T4, the thyroid hormones, comes from thyroglobulin plus iodine. The makeup of thyroglobulin is the amino acid tyrosine. Tyrosine plus iodine will give you T3 and T4. So the operative words here is the iodination of tyrosine is what gives you T3 and T4. Okay? Very important to understand. Thyroid hormones are extremely important. The main function of thyroid hormones, T3 and T4, is to increase your basic metabolic rate. It allows you to run. It allows you to hit a ball. It allows you to do exercise. It also maintains normal body temperature. It also stimulates protein synthesis. It also works with two very important hormones, growth hormone and insulin, to accelerate body growth. Thyroid hormone, growth hormone, and insulin are the three hormones that are required for normal cellular growth. You will have lectures by students in a week or so on hypothyroidism and hyperthyroidism. Okay? In hypothyroidism, that means that you have low thyroid hormone levels, you won't grow. Your cells don't grow. And one of the signs of hypothyroidism as an infant is mental retardation, because the nervous cells of your brain don't grow. So thyroid hormone, human growth hormone, and insulin are the three hormones in growth of your cells. And you know I'm going to ask you that question on exam number 4. Guaranteed, guaranteed. So how does thyroid hormone work? Well, the hypothalamus secretes thyrotropin releasing hormone. This stimulates the pituitary, the anterior pituitary, to release TSH, thyroid stimulating hormone. Thyroid stimulating hormone stimulates the thyroid gland to produce and release T3 and T4. And it's all negative feedback. It's all negative feedback. If you don't have enough thyroid hormone circulating in your blood, the pituitary produces TSH to make the thyroid produce more T3 and T4. Very important to understand. There's T4 and there's T3, and there's also calcitonin. Okay, again, T3 and T4 are under the direction of the pituitary gland. The pituitary gland secretes TSH that stimulates the thyroid gland to release thyroid hormone. Calcitonin, and it comes from follicular cells. The other hormone produced by the thyroid gland is produced in the parafollicular cells, and it's called calcitonin. It's called calcitonin. When you have high blood calcium levels, the parafollicular cells produce calcitonin to lower your calcium level, All right? Speaking of calcium, we now talk about the parathyroid glands. The parathyroid glands are located on the posterior aspect of each lobe. Each lobe has two parathyroid glands, one inferior and one superior. That means that there are 4 parathyroid glands in your body, and you can see them here. These are the parathyroid glands on the posterior part of your thyroid gland. Okay? There are 2 types of cells in the parathyroid gland. The principal cells, or the chief cells, are the ones that produce PTH, otherwise known as parathyroid hormone or parathormone. So the chief cells or principal cells produce parathyroid hormone. This hormone is involved in calcium metabolism. When your calcium is low, the parathyroid chief cells produce PTH to raise your calcium. This is the only cell that's important in the parathyroid gland. The oxyphil cells are not important, and I will not ask you any questions on it, but I will focus on the principal cells or the chief cells. Parathyroid hormone is secreted by the chief or principal cells. Its whole function is to raise your calcium levels. So, what did you just learn about the thyroid gland? You learned about the thyroid gland that the parafollicular cells produce calcitonin, which will lower your calcium levels. And now here is the antagonist hormone in the parathyroid glands that will increase your calcium levels. Okay? It's all calcium levels, All right? And here's the chief cell right here. Here's the chief cell. So, calcitonin is produced by the thyroid gland, and it works in conjunction with PTH from the parathyroid gland and calcitriol. Where does calcitriol come from? Anyone? I got all day. Michael.
Yeah, Professor.
Where does calcitriol come from?
What was that? What would you say again?
Where does calcitriol come from? Here, I'll give you a hint. Look, I'll give you a hint.
Kidneys.
Can you see my arrow?
Yeah, kidneys.
Thank you. Kidneys. So now you have three hormones that work in calcium homeostasis. You have calcitonin produced by the thyroid gland. You have PTH produced by the parathyroid glands, and you have calcitriol produced by the kidneys. All three of them regulate calcium homeostasis. So, what if you have high levels of calcium in the blood? They're too high. You have to lower it. So this calcium, high calcium level stimulates the thyroid gland, the parafollicular cells to release calcitonin. Calcitonin lowers your calcium levels. If your calcium levels get too low, then that stimulates the parathyroid glands to release parathyroid hormone to raise your calcium, Also, if parathyroid hormone has been stimulated, it will also stimulate the kidneys to release calcitriol. And it will stimulate the absorption of more calcium from food and increasing your calcium levels. Let me talk to you now about simple things that you probably learned in AP1 but forgot. Okay? Someone tell me, I'm going to pick on someone. Sarah, are you there? Ooh.
Yes.
Did you take AP1?
Yes.
You should have said no. Okay. Listen, Sarah, remember bone metabolism? Vaguely, right?
Yeah.
Do you know which cells make bone?
Oh, isn't it like osteocytes or something like that?
Osteoblasts.
Yeah.
Okay. The B is for building, osteoblast. They make bone. Do you know which cell breaks down bone?
Is it the osteocytes?
Osteoclast.
Oh, okay.
Okay. C for chewing, osteoclast. You're talking about osteocytes. Osteocytes just maintain bone. They maintain bone. Osteoblasts build bone. Osteocytes maintain bone. Osteoclasts destroy bone. Okay?
Okay.
Now, let me ask you this question. When you destroy bone by stimulating the osteoclast, what mineral goes into the bloodstream?
Calcium?
Thank you. So, if your calcium level is low, Sarah,
Yes.
and parathyroid hormone increases calcium level, which cell in bone does it stimulate to break down bone?
Red blood cell?
No. You got three choices: blast, cytes, or osteoclast.
Can you repeat the question?
Yeah. Which cell in bone does parathyroid hormone stimulate to increase serum calcium?
The osteoblasts?
Osteoclast.
Oh.
Because the osteoclast would break down the bone. Does everybody understand what we're talking about here?
Yeah.
We're putting bone metabolism in with calcium because that's where all the calcium is. All your calcium is in your bone. Okay? So to stimulate increasing your calcium levels, parathyroid hormone will be increased to stimulate osteoclasts to break down bone to raise your serum calcium. That's all calcium homeostasis. Okay? And the opposite is true about calcitonin. If your calcium is too high, calcitonin will be stimulated in the thyroid gland from the parafollicular cells to put calcium back into bone and will lower your serum calcium levels. Are we okay with that calcium homeostasis?
Yes.
Good. Here we go. So what stimulates PTH release? Low calcium levels. Okay, we talked about the thyroid gland. We talked about the parathyroid gland. Let's talk about some very important glands. The adrenal glands. The reason it's called suprarenal is because these two glands are above each kidney. Here they are. Here they are. The right and the left adrenal gland. The glands are divided into two regions, the outer cortex and the inner medulla. Both areas produce different hormones. The cortex is divided into three regions, and yes, you have to know the regions. The zona glomerulosa, the zona fasciculata, and the zona reticularis. I want you to look at the right here. The zona glomerulosa produces mineralocorticoids, cortisone type minerals, hormones that deal with minerals, And the main mineralocorticoid that comes from the zona glomerulosa is aldosterone. You learned about aldosterone in the urinary system. Okay? Isaiah.
Yes, Professor.
Tell me what mineral aldosterone, what two minerals aldosterone controls?
I have no idea.
Did you get it wrong on exam number 3? Because I asked that question.
I don't remember.
Okay, let's see if Kennedy, are you here?
Yeah.
Do you know what two minerals aldosterone controls? It absorbs one mineral and gets rid of the other.
Is one sodium?
One is sodium. It absorbs sodium and gets rid of?
Potassium.
Thank you. The zona glomerulosa produces mineralocorticoids. The number one mineralocorticoid in your body is aldosterone. Okay? And if you can't remember that, look at the word glomerulosa. It almost looks like glomerulus. And what does the kidney do? It absorbs sodium and gets rid of potassium because of aldosterone. The middle layer is the zona fasciculata. The zona fasciculata has in it glucocorticoids. And when we talk about glucocorticoids, the number one glucocorticoid is cortisol. Cortisol. Okay? We also have the inner layer, and the inner layer is the zona reticularis. And the zona reticularis secretes an androgen. And that androgen is DHEA, and we'll talk about DHEA in a minute. It is like testosterone. Testosterone basically comes from your ovaries and testes, but the adrenal gland does secrete a weak androgen called DHEA. Okay? That's the cortex. That's the cortex. Then you have the medulla. Which is the inner layer of the adrenal gland. And the adrenal medulla from chromaffin cells secretes the two very powerful hormones, epinephrine and norepinephrine. Okay? So the adrenal glands produce a lot of hormones, lots of hormones. The cortex itself, with the three layers, produces over 100 hormones, whereas the medulla from the chromaffin cells produces norepinephrine and epinephrine. Okay? And we talked about this. This is what we talked about. The glomerulosa secretes hormones called mineralocorticoids. The number one mineralocorticoid that regulate mineral homeostasis is aldosterone. The zona fasciculata, which is the middle area of the cortex, secretes glucocorticoids that affect glucose homeostasis. The number one hormone is cortisol. The zona reticularis secretes weak androgens, hormones that are giving you a masculinizing effect, like testosterone, but weaker. There you go. There's aldosterone. And it regulates, as Kennedy told us, sodium and potassium homeostasis. Aldosterone is also in the RAS system. Here it is again. The renin-angiotensin-aldosterone system, which controls the release of aldosterone. Very, very important. I'm going to ask you more questions on the renin-angiotensin-aldosterone pathway. Here it is. You are dehydrated. You are low in sodium. Your blood pressure drops because you are dehydrated, because you're losing blood, thereby giving you a decrease in blood volume, thereby giving you a decrease in blood pressure, stimulating the juxtaglomerular cells of the kidneys to release renin. Renin acts on the protein from the liver, angiotensinogen, and converts it into angiotensin 1. When angiotensin 1 in the bloodstream gets into the lungs, it is attacked by the enzyme ACE, angiotensin converting enzyme, to produce the most powerful raiser of blood pressure in the body, angiotensin 2. Angiotensin 2 directly vasoconstricts arterioles and will raise your blood pressure. It also stimulates the adrenal cortex to release aldosterone. Aldosterone will affect the kidneys by increasing sodium reabsorption and getting rid of not only potassium, but also hydrogen, and will raise your blood pressure. This is the pathway. Here it is again. So let's talk about the most important hormone that is released by the adrenal gland. And basically it's cortisol, okay? Basically it's cortisol. Now let me tell you that there are 100 types of cortisol. There's corticosterone, there's hydrocortisone, there's cortisone. There's a lot of glucocorticoids produced by the adrenal gland. And these are important in breaking down protein, making glucose, breaking down fat, giving you a resistance to stress, giving you the ability to have immunity and develop the inflammatory response. This is why when you have an allergic reaction and you have a rash and you're inflamed, we give you not only Benadryl, which is antihistamine, we also give you steroids, and the steroids we give you is cortisol, hydrocortisone, to decrease the inflammatory response, to decrease your immune response. That's what glucocorticoids do. Okay? That's what they do. You're going to have a lecture by a student on Cushing's syndrome or Cushing's disease, which is a glucocorticoid disease. So I won't talk too much more about glucocorticoid. Just know where it comes from, what zone of the cortex it comes from. I told you that the reticularis produces a weak androgen, and that androgen is DHEA. DHEA. It really has minimal effect. It really has minimal effect. But it is a testosterone-like hormone. And because of that long word, we call it DHEA, okay? DHEA, both not only in males, but also in females. Also in females. The medulla, as you learned and forgot already, that the medulla of the adrenal gland is stimulated by the sympathetic nervous system. It is part of the autonomic nervous system, but mainly in the sympathetic nervous system. It secretes two powerful sympathetic hormones by the chromaffin cells. It secretes epinephrine and norepinephrine. You may know it as adrenaline or noradrenaline. I don't like those terms. I use epinephrine and norepinephrine. Both of these hormones are involved in fight or flight responses. It makes you run out of a fire. It makes you fight someone. Okay? Norepinephrine and epinephrine from the chromaffin cells of the adrenal medulla. Here is the review. Here it is. Okay? I want you to understand that when you have low levels of the hormones that are produced by the adrenal gland, the pituitary produces ACTH. ACTH will stimulate the cortex of the adrenal gland to produce all of these hormones. All of these hormones. So the adrenal cortex is under the control of the pituitary gland. Okay? The adrenal medulla is under the control of the sympathetic autonomic nervous system. So that's the adrenal gland. Any questions before we tackle the pancreas? Okay. The pancreas. The pancreas is an accessory gland of the digestive system. 90% of the pancreas produces enzymes. And those enzymes go into the ducts that we talked about to go into the small intestine. So basically 90% of the pancreas is an exocrine gland. However, 10% of the pancreas is an endocrine gland. And that 10% produces 4 hormones. These hormones are in the islets, and they're called the islets of Langerhans. The islets of Langerhans. These islets contain secretive cells that secrete 4 hormones. 90% of the pancreas produces digestive enzymes, but 10% in the islets of Langerhans produces hormones. This is always a Jeopardy question. If you ever watch Jeopardy, the question is, where are the islets of Langerhans? Okay? No, they're not in Tahiti. They're in the pancreas. The islets have 4 types of cells. I only want you to know alpha and beta. The other cells are unimportant. For this discussion, I want you to know that the alpha cells produce glucagon and the beta cells produce insulin. These 2 hormones are antagonistic. Glucagon raises your blood sugar. Insulin lowers your blood sugar. Know that the alpha cells produce glucagon and the beta cells produce insulin. Very important. Don't worry about delta or F cells. Okay? Again, the alpha cells of the pancreatic islets produce glucagon in the presence of low blood sugar to raise your blood sugar. Insulin from the beta cells of the pancreatic islets secrete insulin to lower your blood sugar in the presence of high blood sugar. All right? And here it is. Low blood sugar, known as hypoglycemia, stimulate the alpha cells to secrete glucagon. Glucagon acts on the liver to convert glycogen into glucose. It also forms glucose from amino acids and lactic acid. You know, converting glycogen to glucose is called glycogenolysis. Converting glucose from lactic acids and amino acids is called gluconeogenesis. Both of these functions produce more glucose to raise your glucose levels. If your glucose levels get too high, then you have hyperglycemia. Hyperglycemia not only inhibits the release of glucagon, but it also stimulates the beta cells of the pancreas to secrete insulin. Insulin will accelerate facilitative diffusion of glucose into cells. Let me tell you now that without insulin, you cannot get glucose into your cells. It also speeds the conversion of glucose into glycogen. It increases the uptake of amino acids and increased protein synthesis, and speeds up the synthesis of fatty acids, lowering your blood sugar. If you get too low in your blood sugar, it all happens again. They are antagonistic hormones. Insulin and glucagon work antagonistically. Calcitonin and PTH also work against each other to create calcium homeostasis and glucose homeostasis. Here we are, all right? We will talk a lot more about the ovaries and testes when we get into the reproductive systems, okay? Obviously, you know the gonads are the ovaries and testes. And they produce gametes. And those gametes are eggs, otherwise known as oocytes, and sperm. Okay? Not only do they produce gametes, they also produce hormones. The testes produces testosterone. The ovaries produce 4 hormones. They produce estrogen. They produce progesterone. They produce relaxin, and they produce inhibin. How do I remember those hormones produced by the ovaries? Because I remember RIPE, relaxin, the R, inhibin, the I, progesterone, the P, estrogen, the E. The ovaries produce RIPE, RIPE, 4 hormones, all right? And we'll talk much more about these hormones when we talk about the reproductive system, all right? Some minor endocrine glands. One is the pineal. The pineal gland, if you remember from AP1, is located in the 3rd ventricle of your brain and secretes the hormone melatonin. Melatonin helps regulate your biological clock. You know when to sleep. You know when to wake up because of melatonin from the pineal gland. Also, in the immune system, the thymus produces a hormone called thymosin. And this hormone allows T cells to mature. Remember, T cells mature in the thymus. They mature because of the hormone thymosin. The echinosoids are really not important, but there are other hormones. And these are some of the hormones that you already know. You know the major 3 hormones from the GI tract: gastrin from the stomach, and secretin and cholecystokinin from the small intestine. You also know the three hormones from the kidneys: renin, EPO, and calcitriol. You also know ANP from the atria of the heart. But there are others. Okay? One of them I want you to know is leptin. Leptin is known as the satiety hormone. It suppresses appetite from the fat cells of your body. The fat cells produce leptin to say, you can stop eating now. It's time to get away from the table. Okay? We will talk about the placenta when we talk about the reproductive system. You don't really have to know cholecalciferol, but you should have realized in AP1 that the skin absorbs vitamin D because it produces this hormone. All right? Iconosoids, I'm not going to talk about. They're so bizarre, you don't really have to know them. All right? It's not important. These are not important hormones. All right? But we need to talk about the stress response. This is a word that we never use. We don't use eustress. Eustress is everyday stress. You know, getting up, taking a shower, getting in your car, driving to work, driving to school. That's eustress. Distress is a harmful stress. That's the stress that we talk about. Seeing a snake, hitting a dog, getting in a fight with your wife, getting cut. That is distress. And how does the body handle it? Well, the first response is the fight or flight response. It's the body's way of preparing yourself for the immediate activity on what you're going to do. You see a snake, you run the other way. That's fight or flight response. You cut yourself, you immediately grab it so it won't bleed anymore. That's fight or flight response. However, there is another stage of distress. And that other stage is called the resistance reaction. It is the second stage. It lasts a lot longer. It lasts a long time. It's the healing part of distress. Okay? It's the healing part of distress. The immediate stressors will make you produce epinephrine and norepinephrine. That is the immediate response. That is the fight or flight response. In the resistance part, you are going to have more hormones involved. You're going to have cortisol involved, and you're going to have thyroid hormones involved. So immediately is epinephrine and norepinephrine. That's the flight or fight response. And in the second stage, you're going to have cortisol and thyroid hormone. So that's the difference in the hormone response to stress. Okay? Don't worry about embryology. I'm not asking any questions on embryology, but I'm certainly going to ask questions on aging. What happens as you get older? As you get older, do I have as much testosterone as you guys have? No. My hormone levels are decreased, except epinephrine and norepinephrine. My levels are equal to yours because I need them for stress response. Okay? So that's important. There are endocrine disorders. I've given you PowerPoint assignments on them. And you're going to have a lecture on acromegaly. It's different than gigantism. And we'll talk about both of these when we have the lecture on acromegaly. It's a pituitary disease. You also are going to have a lecture on hyperthyroidism. And one of the major reasons for hyperthyroidism is a disease called Graves' disease. You're also going to have a lecture on Cushing's syndrome, which is an excess of glucocorticoids or cortisol. But I do want to talk to you a little bit about goiter, This is an enlargement of the thyroid gland caused by a reduction in the production of thyroid hormone. Okay? Here it is. Here is goiter, an enlargement of the production of thyroid hormone. Now, I told you that thyroid hormone, T3 and T4, is made up of thyroglobulin and iodine, basically the amino acid tyrosine and iodine. So if you lack iodine in your diet, you will develop a goiter because the thyroid gland will increase in size trying to make thyroid hormone that it cannot make. This is always a dietary problem. Lack of iodine causes goiter. Mary Kay.
Hey, Professor.
Tell me a food source of iodine.
Spinach?
Yeah, that's one. You know any more? A major food type. What do you think?
Like as in vegetables?
No, well, that's a major food type. What about, I'll give you three choices, okay?
Okay.
Here are your three choices. Carrots, beef, or fish?
Beef?
Fish.
Oh.
Fish is a major source of iodine. Major source. Okay? So a diet depleted in iodine will give you a goiter. How do you think we cure this, Mary Kay?
Like, how do you get rid of an iodine deficiency?
Yeah,
You either take iodine supplements or eat more iodine.
bingo. That's it. And that'll shrink. It'll be normal. Okay? Because now you can make thyroid hormone. Without iodine, you can't make thyroid hormone. Everybody understand that? Okay. I think that's the last slide. Let me see. It is. Good. Who did I lose? I do. There is one endocrine disease that I did not assign. Actually, there's more than one. But before we leave class today, I want to talk to you about diabetes mellitus. Okay? This is one disease that I did not assign, but I will give you a lecture by another one of my students on diabetes mellitus. And type 1, there are two types of diabetes mellitus. Type 1 is total lack of insulin, and type 2 is a little lack of insulin. Okay? So, what is type 1 diabetes? It's also known as juvenile diabetes or insulin dependent diabetes. It is a chronic, and this is the most important word, autoimmune disease, in which the insulin producing beta cells in the pancreas are mistakenly destroyed by the body's immune system. Insulin is the hormone needed to allow glucose to enter the cell to produce energy. When glucose cannot enter the cell, your plasma glucose rises. There is currently no actual cure. To summarize, there is no insulin to let sugar into the cells. So sugar builds up in your bloodstream. The only way glucose gets into your cell is with insulin. It's called facilitated diffusion. It's from AP1. Okay? The pancreas produces no insulin. The exact cause is really not known. It is believed that the body's own immune system mistakenly destroys the insulin producing islet or islets of Langerhans cells in the pancreas. The beta cells are destroyed. There are factors involved in the causes. Genetics is the big one. If you have diabetes in your family, you have a very high chance of getting diabetes. Also, exposure to viruses and some environmental factors. It is important to note that diet and lifestyle choices do not affect the onset of type 1 diabetes, but they may affect the development of type 2 diabetes. So, what are the symptoms of diabetes? Well, here she has the 4 T's: thirsty, tired, toilet increase, it means you're urinating too much, or thinner. Actually, in medical school, we learned the 3 P's. Polyuria, you pee too much. Polydipsia, you drink too much. And polyphagia, you eat too much. So the symptoms are increased thirst, frequent urination, extreme hunger, weight loss that you didn't intend to lose, irritability, fatigue, blurred vision, and bedwetting in children. The risk factors, I said it before, family history and genetics is number 1. Also, where you live is also a factor in developing type 1 diabetes. It can appear at any age, but mostly type 1 diabetes occurs between the ages of 4 and 7. I have seen in my practice, when I practice emergency medicine, as young as 18 months old, a person with type 1 diabetes that I diagnosed in the emergency department. Okay? It's most commonly diagnosed after a viral illness, And the test for it is a blood sugar. If your random blood sugar is over 200, it suggests diabetes. If you have a fasting blood sugar of over 100, it suggests diabetes in a 6-hour fast or 8-hour fast. Or we can do an A1C glycated hemoglobin test. And if your A1C is over 7, you probably have diabetes. There are many complications with diabetes. The majority of your life is spent getting your blood sugar to be normal. You're going to have deadly episodes of hyperglycemia, high blood sugar, and hypoglycemia, low blood sugar. Okay? Now, let me ask you the question here. I'm going to ask, who can, Pre. Oh, Pre, you left me? Linnea. Are we still talking to each other, guys?
Sorry,
Melanie.
I'm there.
Oh, I'm sorry. Yeah,
I couldn't turn on my
which
mic.
who's who there? Who's who?
Oh, I'm Preet.
That's what I thought. Okay, Pre, let me ask you a question.
Okay.
You see a patient who has a blood sugar of 700. The normal is 100.
Hmm.
What hormone do you give them to lower their blood sugar?
Insulin.
Right, insulin. Good. All right. Now, don't go away. Can I ask one more question?
Hmm.
You have a patient who's comes into the emergency department whose blood sugar is 20. 20. What hormone do you give them?
Glucagon.
Bingo. All right. That's it. That's how you treat it. That's how you treat it. Okay.
When I was diagnosed, I'm type 1 diabetic. My blood sugar,
Maddie, this is Maddie, right?
yeah, was 890 when I
I
was,
believe it.
yeah,
I believe it.
but
Yep.
yeah,
And you're fine. Good.
yeah, it's totally
Excellent.
fine.
All right. Chronic high blood sugar can cause blindness, kidney failure, heart disease, and leg amputations. The number 2 cause of being on dialysis, kidney dialysis, kidney failure, is diabetes. Does anyone know what the number 1 cause of being on dialysis is? What medical disease? You learned about it in the cardiac system. What is the most common arterial disease? We talked about it all the time. You even had a lecture on it. One student gave a lecture on it. What is the number 1 arterial cardiac disease? Number 1, most common in the world.
Is it high blood pressure?
Yes, it is high blood pressure. High blood pressure is the number 1 cause for dialysis. Diabetes mellitus is number 2. There it is. All right. There is no cure. There is no prevention. It remains constantly managed. People need to be on insulin. People must continuously and carefully balance their insulin intake with eating, exercise, and other activities. They measure their blood sugar through finger pricks or wearing a continuous glucose monitor, and they must work closely with their doctor to determine the dosage and types of insulin that they are using. And there are many types. I'm not going to go into the types, okay? But there are many types of insulin. And in today's world, you can also get a pancreas transplant, or an artificial pancreas, or an insulin pump, All right? And that is it.